Let's
my gosh.
Hold on, let's do this.
Oh, brilliant.
Yeah, let me have that.
There you go.
We
It's
gotta,
your wife, Brittany.
It's probably the baby.
We can
Hold
chat.
on. So this podcast is going south, literally.
Sorry.
boy.
I mean, I'm afraid that's the vibe. I'm terribly sorry.
Yeah, you don't spray that on your skin.
Don't you?
No,
I do.
I use that. No, because that's bleach.
What?
It's like a bleach. It's
I've been putting it on every day. Hello and welcome to the Joy of Shopping podcast. My name is Emma Real-Davies. I'm a QVC presenter, garden expert, and the new host of the Joy of Shopping podcast. And I have tried to look my absolute best today for my incredible guest, guys. You are going to lose it. Not only a world-renowned facial plastic surgeon, but also the star of Botched, and also founder, of course, of the QVC skincare line, Nassif MD. It is Dr. Paul Nassif. Welcome.
But what an introduction.
Thank you.
Energy.
Did you like that?
Yeah, actually, gardening.
Yes.
Wow.
Yes.
So that's that is a big thing out here.
Yeah, it is a big thing out here because, of course, you don't live in the UK. You've come over very specially for many a reason, work-wise. But yeah, gardening is a big thing. I love. Do you have a garden?
Not really. No, where I live by the ocean, really, there is no room for a garden.
Okay, but you have the ocean as your back garden.
Yeah, that is my
Well, that's
exactly.
fabulous. I mean,
all
coral,
kinds of things grow in there.
Fish. Yeah, brilliant. And I've got to talk to you about fish later on, actually.
A lot of sharks, too.
A lot of sharks.
Yeah, a lot of sharks out. Dolphins, sharks, and seals.
Seal. Oh, my gosh. And you can all witness this from your bedroom window.
Dolphins, seals, and actually I've seen a few whales.
Have you? What sort of whales?
No sharks, though.
Okay.
Probably gray whales, I think, or black whales. I don't even, Also, orcas even go by once in a while.
No way.
Of course.
And you've seen them spurt with their...
And that's what we usually see, because the way out there, we just see the water shooting out.
That's incredible. Yeah. Do you own a pair of binoculars?
We do. I do. Actually, I have a telescope, too.
Do you?
Yeah, the wife got a telescope, so you can get on there and...
Fantastic.
Really see
and look at all the super yachts and the pirates coming in, etc.
Yeah, we see the pirates coming in.
Do you really? No, okay, fine. Dr. Paul Nassif, it's such a joy to have you on the podcast. Let's start, of course, by talking about shopping. What was the last thing you bought?
Yesterday.
Go on.
I was with Allie Young, and we went shopping, or she showed me around, and we went in, Selfridges? But I was looking for some shoes.
Okay.
And we ended up not getting them there, but we ended up going to Hugo Boss, and I bought 2 pairs of shoes.
Did you?
Yes.
Tell us what they're like.
They're kind of the casual but formal, sneakerish.
Okay.
You can wear casually with jeans or with the suit.
Nice.
2 colors, black and kind of an off-white.
And are you wearing them today?
No.
Oh, no.
I didn't.
Okay.
I have kind of the shoes I bought now, the shoes I'm wearing today are kind of like it.
Okay. Nice. 2 pairs of shoes. What
That's
a treat.
right.
Are they going to fit in your luggage? Have you made sure of that?
I might just bring the whole bag on the airplane.
Okay, fine.
Make it easy.
Yeah, and then you can just whack your bottle of water in, your Pret sandwich, etc.
Exactly.
Yeah, do you get a Pret sandwich when you go to the airport? Are you that kind of person?
No, wait a minute. What's that? What?
Oh, God, sorry. Right, okay. So, we have like Starbucks.
Yeah.
And then in the UK we have Costa Coffee. Do you know Costa Coffee?
No.
Anyway, and then the most elite out of them all, in my humble opinion, is Pret-a-Manger. French, but not French.
Okay.
Do you know what I mean? Like ready to eat. Anyway, and it's just a classic thing at an airport. You've got to get a Pret sandwich for the plane.
All right,
Yeah.
we'll see about that
Yeah.
when I get there.
Yeah, okay, great. I love that. Can you tell me, if you were to go shopping right now and buy one item that would represent your whole personality, what would it be?
Golf clubs.
Ah, nice.
I do need some new ones.
Do you? Have you got one of those ones made that is literally like bespoke to your stance?
Well, they actually, if you get golf clubs, if you go to the right place, they will fit you.
What does that mean?
They'll actually watch your swing and the speed of it and all that, and they'll give you something that is for you.
Really?
Yeah.
So hang on, are there golf club shops that are on golf courses so they can watch your swing? Because surely you can't be swinging a golf club in a normal shop.
Like that, yes, there are places like that, or places that actually sell one specific type of golf club. You can go to their place and they'll have a driving range. And they'll film you and watch it, yeah.
And do you get specific balls? Do you have to buy specific balls for your club?
No.
So the balls are just generic, unique.
Well, whatever you want to buy. There's all
Right.
kinds of golf balls.
Okay, fine. So you're a big golfer.
Well, I'm a wannabe.
You're a wannabe
I'm a
big
wannabe
golfer.
big golfer.
Okay. So how often are you golfing?
Couple times a month at the most.
Okay.
I just don't have the time.
You're too busy working.
Too busy.
Okay, so obviously you're busy working on Botched, which, as we know, is wonderful and really, like, so many powerful and amazing stories about people that have had, horrible incidents with other terrible, plastic surgeons or whatever, and then they're coming to you and you're just transforming them and sort of, really, realigning their whole face. Tell us what it's like working on Botched, really. Like, is it really as sort of like as real as it seems watching it on TV?
Yeah, everything you see it's candid. It's raw. It's real. Those patients coming in either that have had too much and they want more, or patients that have had. Remember, it's not just having plastic surgery that's bad, but maybe they had a severe complication, which can happen, or they might have been born with a defect or something that we're trying to fix. So yeah, that's everything you see is real.
Has there ever been like one particular case that has stuck with you, whether it was like, something you were really proud of, or just particularly complex, or maybe quite emotional?
Mm-hmm. There's been a few, but I'm going to say the most recent one was on the last airing, season 8. It was the last patient. This poor young lady was from Mexico, and she had a large tumor on her face. It was this long that she had when she was very young, and basically it pretty much stopped everything she did in her life. And she had that, and we actually took her to the operating room. We removed this gigantic tumor. She healed, and it basically transformed her life. And that was emotionally cathartic just to watch that.
Do you often hear from your patients sort of like a long time after they visited you, about how they have had their life like transformed by you, like maybe many years later or something?
Oh yeah, I mean, listen, you do hear that, which is great. I mean, that's what makes everything worth it.
Yeah.
Is that when you actually see these patients and you do transform their life and you help them. And that's wonderful. That's what it's all about.
That's so lovely. So can you tell us about a time perhaps where someone has come to you? Because I know you're very good, by the way, at saying no, as well as saying yes. Like if you have a particularly young patient or something you just don't quite think is going to work. But have you ever had a really strange request that you're like, this is the most bizarre thing that I've ever been asked to do?
Oh boy. I had someone who wanted me to try to transform their ears into elf ears.
No!
Yeah. He was really into the elf thing.
Really? Yeah. Like Legolas?
Yeah, just exactly. And I couldn't do it. One, we don't do that. I'm not going to take someone and make something that is not appropriate, shall we say. Because remember, my goal is to fix things, natural.
Yeah.
Not to create something. So of course, I said no, and I'm sure the patient said, I'm going to keep looking. And I'm sure who knows, he might have found someone to do that. Give him elf ears.
So hang on, but did he say why he wanted elf ears?
Because he's into the whole elf, looking like an elf, dressing like an elf, and acting like an elf.
Is that a thing? I didn't know that was a thing.
I didn't know either.
Did he look like an elf?
He came in dressed like an elf.
Like, are we talking like elf, like as in the Christmas film Elf?
Yes, exactly.
As in he literally came in like a little green suit with like pointy shoes on? No.
Actually, partially green suit, the rest was some other, but with kind of this normal shoes.
Oh my word.
And did not wear a hat. Didn't wear the elf hat like you see in the movies.
Hang on, is this just like a day-to-day thing, like where like someone, I don't know, or is this like are we talking like an underground thing? Do you know what I mean?
I have no clue.
Okay, fine.
Who knows? There might be a whole set of elves out there.
Really?
You never know.
My word. I'm going to do some research on this. This is quite incredible. Okay, elf ears. Never heard of that one before. That's interesting. Okay. Talk to me about your amazing Botched co-star. If the two of you were to go shopping, who would be more diva-ish? Like, who would be the one that, spends longer trying things on, would have 20 things in the fitting rooms?
Probably it's going to be me.
Really?
Yeah, Debra is more a diva just as a person.
Okay.
I am when it comes to going to a restaurant, probably going shopping. I'm a little bit more picky that way.
Okay, fine. Interesting.
That's going to be me.
So why do you say that he is more of a diva in person?
Well, no, what I mean, I should say he's more of a, he loves himself. He loves showing off, this guy. He kind of loves hearing himself talk, I think would be the great word.
He loves his own voice.
Yeah, he loves the sound of his voice.
Okay.
And me, obviously, you're right. I am a little bit more picky. No matter what we do, I'm probably going to be more picky-ish, I got to say.
Oh, really?
Gotta
Well,
say
like
it.
you're the sort of person that, like, if you order a meal in a restaurant and you
Yes.
don't like it, you will send it back.
Yes, I do.
Really?
Yeah.
And what?
And he probably will not.
Oh, really? Okay, interesting. I thought you'd be a big fan of a gadget. Shall I tell you why?
What's the gadget?
Oh, a gadget. Oh my gosh, I love this. This is like, because
I mean,
obviously...
a gadget? What is it?
A gadget. You know, like a... Oh my gosh, what do you call it?
What-
How do you explain a
Well,
gadget?
A gadget is a device
Yes.
or something
Yes.
like to fix something or
Yes.
whatever. Yeah.
Exactly. I thought you'd be
Now,
a...
we already have all that stuff.
Okay,
I mean,
fine.
there's probably nothing I don't think that would have to actually get.
Okay, fine.
So the term would be we have all kinds of gadgets at the house.
Fine, okay. I just had you down as the kind of guy that would like see something on the internet and then you'd be like, oh yes, that's going to improve my life with this cheeky little gadget. And the reason I asked...
Tell me why.
Well, because I saw a clip of you inspecting your earwax
Oh,
with
No, that was that was
this was on Botched, and so you were inspecting your earwax. It was like a pen
camera.
type thing with a
Yeah.
camera in the end, and you were having a little look around at your
now,
earwax
those type of
ears.
gadgets.
Yeah.
So once in a while on my Instagram feed, there will be an interesting little
Oh,
gadget.
here we go. It comes out now.
So all right, so I will
you
send
pretend you
that.
don't like shopping.
I personally am not going to order it, but I will send that gadget to Brittany, and then she'll order it.
Okay, fine.
So I will, but most of the time when you order a gadget, it usually doesn't work as well as they show it to work.
Well,
Or maybe I'm just not good at using the gadget.
Well, I think you are, because we all saw your earwax
surgery,
on
so,
Botched,
yeah,
so you
that's
know
true.
it did the job. And I have to ask as well, because obviously, if you haven't seen the episode, by the way, that I'm talking about, and what then happens, which I will
Sounds disgusting to think about.
I will tell everyone about, is that your colleague, Dr. Dubrow, then uses the gadget for the earwax to pop up his bottom to have a little look at his hemorrhoids, which then appeared on the camera. So
my God.
Yes,
They
well
actually-
that happened. We watched, have you not seen it?
But that's been a while ago. That really does sound disgusting, though.
Yeah, I mean, it wasn't very pleasant, but did you take
They
it?
actually showed a picture of his hemorrhoid.
Yes!
They showed of his
I
rectum.
saw it on a screen on an iPad. A picture of his hemorrhoid. It was there in real life. And then he then returned the device to
And
you.
I assume I threw it away, I would hope.
Well, that's what I was going to ask you. Don't you
sure I
remember?
did.
Okay. It's not in your car or
No,
anything.
I don't even think about something like that. That sounds very disgusting.
It was very disgusting, but also hilarious.
So this podcast is going south, literally.
Sorry.
boy.
I mean, I'm afraid that's the vibe. I'm terribly sorry.
Okay, that kind of got me nauseated thinking about his hemorrhoid. I started sweating.
I mean, you were the one that saw it on the iPad. Well, I mean, clearly you've erased it from your brain.
Oh, God, at least of my memory.
Okay, so you've obviously got your amazing skincare range, Nassif MD. Can you tell us what makes it different? Obviously, it's quite a saturated market, generally skincare, and we've got, all sorts of creams and, moisturizers and all sorts. Tell us what makes yours so special.
First of all, facial plastic surgeon created. I don't really know if there's any skincare line, because what's different about that, and listen, there's a lot of good skincare out there, but I'm seeing the skin from the outside and from the inside. And I can see really the quality and what happens to the skin. So thinking about that, or taking that knowledge and working with excellent chemists to get really different parts of the face need different types of clinical grade products, whether it's around the eye, on the forehead, the nose, the neck, the décolleté, whether it's a certain type of retinol, a certain type of hyaluronic acid, or, one of the new things is niacinamide, for example, a derivative of B3. And so I will take skin-specific clinical grade products and put them together synergistically with other key ingredients and make something.
Amazing. Oh my gosh.
Not just, okay, let's just take this basic hyaluronic acid. Usually I will mix 3 to 4 clinical grade ingredients and put them together to make some wonderful formulation for, let's say, around the eye.
Okay. So say, for example, because obviously you've got so many wonderful products in your range, but if you were to go to a desert island and you could only take one with you, what would it be?
Well, you need to clean your face all the time. You have to, and exfoliate, and do other things. It's going to be our detox pads because we're cleaning, exfoliating, and delivering anti-aging, different benefits to your skin. So the detox pads.
And they're so quick and
Sold
easy.
a couple million already across the world.
It's incredible. They're so brilliant because they are literally so quick.
Especially if you're on a
easy.
desert island, you got to use that.
Yeah, exactly. We don't want sand getting in, our eyebrows
Your
or
pores are
whatever.
going to get destroyed.
Yes, they are exactly. But we might see some whales, so that is the positive. Is there a skincare mistake that you see people doing all the time?
Putting skincare on top of really not clean skin, where it's not exfoliated and the pores are clogged.
Right.
So you're not prepping the skin to get ready for that skincare.
Okay.
Then with that case, basically what's happening when you're not getting it ready for it, it's actually, it's ineffective.
Right.
So you're wasting money on skincare because it's really not really going in, it's not getting absorbed properly into your skin.
So what are people doing? They're not cleaning their face thoroughly enough, or?
Exactly. Like taking a detox pad, that preps your skin ready for any skincare line you want to use.
Okay. How do you feel about, so I would say that this is a thing that a lot of us in the UK do, and we're not great at skincare. By the way, I'm obsessed with skincare. I've literally been on a whole journey, like with a dermatologist. Oh, anyway, I'm not going to bore you with it, Dr Nassif, but anyway, it's a whole thing. But I feel like there was a phase, like a couple of, maybe like about 5-10 years ago, where I would say on average, virtually every woman, but also some men in the UK used a facial wipe to take off their makeup. Is that not?
Well, everyone still does that. What we do is we actually do a demonstration of taking off makeup with the facial wipe versus the detox pad. And we do it here at QVC, for example.
Yeah.
And it's something, the facial wipe does take off some makeup, but it's still not that effective.
Really?
Yeah.
Okay, fine.
So that's going to be probably the big mistake.
Right, okay, fine. So my next question for you is, and I've often wondered this, right? If we, a lot of us, and I'm sure a lot of you listening, have got limited budgets when it comes to skincare or aesthetic treatments. Is it better to have a really good skincare regime in place that we kind of do really, really regularly, and maybe we spend a bit more money on some like really nice products? Or is it better just every so often to have one treatment that's like, a little bit of Botox or some microneedling or some salmon sperm if you want to?
Well, to me, the way to listen, while you're young and stuff, it's always great to start a couple of items for your skincare. Because if you can do that routinely, starting young, your skin's going to be great. Botox works differently. That has nothing to do with skincare. Topical skincare. That's something you can do prophylactically when you start knowing that you're going to get wrinkles.
What does that mean?
That means, let's say you start frowning a lot, and that will create wrinkles eventually. So you can get a little bit in advance of Botox. But taking care of your skin early is always the best thing to do.
Okay, cool.
Always.
So are we SPFing every day?
All the time, of course.
Okay, brilliant.
Hydrating the whole bit.
Can you tell us about your skincare routine? Do you use your own products?
I sure do.
Okay.
And my detox pads after I shower in the morning, and I have about, I use my brand new, which we're launching out here, the niacinamide biopeptide serum first. And I use my décolleté product, my neck product. I use my periorbital, then I use Hydroscreen.
Oh my gosh.
And then I use, after that, an SPF.
Oh my, and you do that every day?
I sure do.
And every night?
Night, I do it different.
What do you do at night?
Detox. I use that niacinamide biopeptide serum. And then I will use almost the same thing. Yes, and also use a pure hydration night cream.
Do you ever not do it? Like, do you ever?
Yes, if you get tired and you're exhausted, you go to bed and you don't even wash your face.
You just stop
Happened.
it.
It's rare, but it
Paul,
happens.
I cannot believe that. So there is the odd occasion where you don't wash your face.
Oh yeah, you just pass out. You lay down and
What do you mean you pass out? What are we doing?
You're just tired. You're lying down and you're doing, you're doing a little bit of emails, and you haven't done anything yet. Next thing you know, you fall asleep.
Oh,
it happens.
Okay, so we were talking before the podcast started about how, you don't travel loads, but you do travel. Obviously, you've flown over from the States to be here, which we're very grateful for. And what do you do on flights with your skin?
Oh boy.
Are you one of those people that sits there with the Korean beauty masks
No.
and you have champagne delivered to you and you're just loving life? With your sort of hyaluronic acid, zooping into your face.
No, well, I'm not doing any of that. While I'm traveling, I'm relaxing and watching some movies. Don't do anything for the skin. I do bring my detox pads. I'll use that at the end.
Okay, but not during?
No, I don't. I haven't seen anyone do something like that on a flight yet.
I do it every time.
See, then there you go.
Oh my God, you've never seen anyone do that?
No one do a mask on a flight.
Oh my gosh, it's a TikTok thing.
Okay, there we go. I'm missing it again.
You're missing it. You're not on TikTok. I thought you were, aren't you?
Well, we do stuff for TikTok, but do I watch it? No.
Okay, fine. You're far too busy and important. I like that. You're not a scroller, I can tell, Dr. Paul.
No,
because if you were, you'd be buying a lot more gadgets. So, can you tell us, have you seen some certain trends in facial aesthetics and skincare that you're thinking are going to be the next big thing?
What we do is we're always looking for what is the newest and greatest skincare ingredient. Mm-hmm. And that's what we do, in regards to skincare. And we're always looking for the best research. We don't just jump on, like you said, the next TikTok thing. We look at science-based ingredients and see what they do. I know it's boring.
No, it's not boring. This is what we want.
I'm giving you a boring answer, but that's how we actually put it all together.
But have you seen recently some trends that even if you're not jumping on them, you're like, okay, this is what I can people are going to be doing this ridiculous thing now for the next couple of years. It's all a load of rubbish. I'm sure if you had more time, you'd be telling everyone, don't do that. It's a waste of time and energy. Is there anything you've seen that you thought, go
salmon
on?
sperm injections. That's what we're talking about. I mean, listen, the thing is, since I'm not scrolling, I'm a little bit unaware of some of these crazy things that they're doing, especially these TikTok challenges and TikTok things like you're saying. So, I don't see those things.
No.
Now, my social media person in my office will bring some of these things and say, well, what do you think about this? And, people are doing this and I'm going, that sounds ridiculous. I think most of the things you probably see on TikTok are going to be ridiculous.
I mean, they are. I mean, there was this one thing that springs to mind.
Fads. What?
Yeah. I'm sure this is probably quite dangerous. Please do not try this at home. Where a lot of people were putting their lips into a shot glass. Have we seen this before?
Getting them stuck?
No, well, yes, sometimes, and then they would have to go to the hospital, and it was all a drama. But they were putting their lips into a shot glass, and then they were sort of compressing them, so that then when they removed the shot glass, they were massively swollen and big.
Yeah, it's cutting off the blood supply and irritating it and inflaming it. Yeah.
Oh my God,
that's not the smartest thing in the world.
That's dangerous.
It is dangerous.
But also, what about the spray, the hypochloric acid spray?
Yep.
Are we a big fan?
Hypochlorous acid.
Hypochlorous acid.
Yeah, you don't spray that on your skin.
Don't you?
No,
I do.
I use that. No, because that's bleach.
What?
It's like a bleach. It's.
I've been putting it on every day.
No, that will actually probably ruin the normal flora on your skin.
The flora?
The natural microbes or the microbials and the natural bacteria that live on your skin.
Oh, this is why I'm drinking the kefir. Yeah. How do you pronounce it?
Yeah. Kefir.
Kefir. We were chatting before about what we had for breakfast. I said I had kefir.
Now I use that on incisions or a wound.
What, kefir?
No, the hypochlorous acid.
Sorry. Okay. Oh my gosh, it's like bleach.
Yeah. It smells like bleach, but it's an antiviral, fungal, bactericidal, so it kills everything.
So it's good for a verruca, but not for your skin.
Not for your natural skin.
I am just going to carry on with my detox pads. I'm going to throw that in the bin. Oh my God, I'm terrified. Now I'm panicking. Everything I use is like bleach. That's really horrible. Come on.
Well, it smells like bleach.
Okay, because I have got this weird new lump on my nose. Maybe that's, anyway, whatever. That's not what you're here. But it's gosh, I can't believe it. Okay.
That must be, you know what? How much you want to bet it's my wife? Hold on, is it?
Hang on.
Wait, watch this.
Oh my gosh.
Hold on,
Who
let's
is
do
it?
this.
Oh, brilliant.
Yeah, let me have that.
There you go. It's your wife, Brittany.
We can
chat. Okay, it's baby Paul. How exciting.
It is. Look at it's the two babies.
Oh, hello.
You guys are on.
The two babies. Oh my gosh, the two babies.
Little Paul's got a little.
He's got a helmet on.
He's got a helmet. What the helmets are for?
No.
You don't know what those are?
No. Why is he wearing a helmet?
He had a flat head in the back from lying down. And these helmets, what they do. And there's Paulina. Hi, baby.
Oh.
And so what that does, it actually helps shape the head. You wear that for about 2.5 months.
No.
Oh, yeah.
Really?
And they go in every week and they actually show you where, push on that side, let that side expand so he can have a nice head.
Oh,
right?
that's just, gosh, I might start wearing one of those.
Say hi, baby. Look at these kids.
Can I just say how beautiful your wife is? She's
That's
just
Brittany.
phenomenal.
You're gonna pop your head in there? No makeup. But she's using
oh my God, look
Nassif
at her.
MD, right,
Stop
girl?
it. The glow is unbelievable. I can't
It's pretty
deal
early
with
out there.
it. Oh my gosh. That is phenomenal. Oh, she's gone. Okay. Wow. Just final question to ask you about, well, I've got two more actually, but final question is, when you wash your face, and I really don't want to gender stereotype here, but what my husband does, he gets some soap, like hand soap. He's terrible. I have tried to get him onto your things, but he's, no offense.
He's got to use detox pads.
Yeah, I know. I've tried.
Tell
Dr.
me he won't
Nassif.
have to wash his face.
I've tried, but he's not interesting.
So you already know what I'm going to say.
What he does is he squirts the soap with, like a pump hand soap.
You mean like just hand soap?
Yeah, like hand soap, like Carex, it's called, what we have here in the UK. Or like sometimes I'll just get the Aldi version. Do you know Aldi?
No.
Oh, it's a cheap supermarket for, cheap
for your
people.
Hands.
Yeah, for your hands.
Like
so he'll squirt the soap into his hands with a couple of pumps.
Yeah.
And then what he'll do is he'll rub it very aggressively like this in his hands. Yeah. And then he'll rub it on his face like this. Like to really rub.
He thinks he's exfoliating.
He's just sort of like being so aggressive. Yeah. Whereas what I do is I get a tiny little pump of my niacinamide cleanser, and I will just gently with my fingertips do little rubs.
You got to try Nassif MD Pure Gentle.
I haven't. It's on my list. It's on my list. It's on my list.
Okay, so what's the...
Okay, so the
you
point
do it
is...
beautifully and he does it aggressively.
Yes, but does it matter?
Now, listen, guys are going to do it a little bit fast and furious, I mean, for example, when I'm in the shower...
Not always.
when I'm in the shower...
Yes. Go on. I thought we weren't talking about personal habits.
No, hold on. Talking about washing face. We're going clean here.
Okay, yeah, go on.
Fast and furious of washing your face.
Yes, of course. Thank you for clarifying.
So my Nassif MD cleanser.
Yes.
I will do, all you need is one pump. I'll go like this. Not 4 or 5 pumps, one pump.
Yeah.
I will do that, and I will do it fast.
Right.
Because I normally use a detox pad.
What sort of speed that we're going for? Okay, so this is sort of like, what's a mid-tempo? Mid-tempo. Okay, nice. Ooh.
Done.
Okay, fine. Done. And then wash. But that's it. That's how quick it is. And it would just exfoliate and do all the cleaning in that time.
Well, then I still use a detox pad after.
Okay, gosh, wow. Okay, that was good to know. Thank you.
But it's,
I just don't like the aggressive...
What do you spend, a whole 30 seconds? Or?
I'm there for about, I would say 12 minutes rubbing.
Rubbing your face, that's probably the most ridiculous thing I've heard, ever. 12 minutes, that's kind of, waste of time.
Is it?
Yeah. That's what you spend your time doing? 12 minutes?
Well, that and spraying bleach on my face, apparently. And researching
maybe I helped
sperm.
You with this.
So
it's doing no good. Maybe spend about 20 seconds is all you need.
Oh my God. Do you know what's really embarrassing is you've probably come into here and met me for the first time and thought she has got the worst skin and face.
No, you have great skin.
No, I don't, but that's very kind. So you see, and you say that, and yet you've just said that my 12 minutes is a waste of time.
Well, it is a waste of time.
So maybe it's doing, it's doing the job. Maybe. Okay, final thing to ask you. Is there something that you will refuse to spend your money on when it comes to shopping? Like something you're like, no,
Since I don't go shopping.
Yes, well, that's true.
I have no clue.
Okay, nothing.
Let me think. Put it this way. I'll say this. I don't like being gouged. So let's say there's a gadget. And you can buy it here for this price.
Yeah.
But this other store is going to be 2 times more expensive. Mm-hmm. I do like going to this place to buy it.
For the cheaper price.
So I like a good value.
You do? You like a bargain?
Well, I'm Lebanese background. We like to bargain,
Yes. Do you haggle when you buy things?
You mean like at the supermarket?
Yeah.
Like go to Costco and say we get a better price? No.
You don't do that?
Now, if you're going to go buy a car, of course you're going to bargain.
Do you?
Everyone does that.
I don't.
If you buy a car, you don't. You're telling me you buy the list price on the car?
Yes, but
You always can get a bargain. Actually, you always can get a bargain on bigger things, like buying a home.
well, yeah, but that's different, though.
Same
isn't
thing
it?
like buying a car.
But hang on, I probably don't buy my cars in the same way that you buy your car. I say buy my cars. I have one car, and I bought it from a woman who lives in Birmingham.
But I'm sure she says, I want blank for it, and you probably went and asked for a different price.
No, I didn't. I just paid her the money and left.
Okay, well then what about your husband? How come he didn't help with that then?
Oh, well, I don't know. I can't remember what he was doing at the time. He was probably washing his face aggressively or something.
Did he say anything to you, like, you spent how much on that car?
No, because it was literally a very cheap car. I'll tell you how much I spent on it, and you won't believe it. I spent, I think it was £6,000. No, it wasn't even that many. Much.
That's like 7,000 or whatever it is US. That's a lot of money.
Well, it is a lot of money, but maybe. Oh God! But hang on. Now I'm.
The question is like a car with how many thousand miles? What kind of condition was it?
Yeah. Well, it was in. Okay, I'll tell you what. Okay, let me tell you. So it's a high-end.
What is the Blue Book value of the car?
The what?
Blue Book, which means you take that car, look at the age, how many miles, what kind of condition, and it will tell you what the car is worth.
Really?
I don't know if they have that out here.
We have a website called Auto Trader here,
and we have that out there.
Oh, you do. So you put and what's that other one? WeBuyAnyCar.com.
What? We buy any car? We have
WeBuyAnyCar.com.
So did you read it and put the numbers in and see what it's
yes,
said?
And actually what happened, you'll enjoy this story, Dr Nassif. What happened was, sorry, is this boring? I'm going to tell you anyway. Okay, no, yeah, do you want to phone your family back? Yeah, that's fine, no, I'm joking. No, basically we went on holiday, he's gone to sleep. Don't worry about it, it's fine. No, we went on holiday and we had a hire car. It's a long story because our other car had broken.
A high car?
A higher car.
A higher car?
Not a high car, no. It wasn't like a Range Rover or anything, just a higher, like we rented it.
You mean you rented a car?
Rented a car, sorry, yes. There's lots of, language barriers here, I'm enjoying it. Anyway, so we rented a car.
Well, you also speak the proper English. I don't.
I don't think I do. Am I well spoken? Really?
You are.
Oh, great.
I mean, English is the proper,
Yeah, I did do that at university.
Us
I did study
Americans,
English.
ruin it.
Yeah, you did. Well, that is true. But anyway, don't worry about it. It's not your personal fault. Anyway, so we rented this car.
Yes.
And then what happened was it was terrible and awful. And there was water coming into the footwell. It was in Yorkshire, which is in a place in the UK. Yeah, do you know Yorkshire? Yeah. Anyway, there was water coming through the footwell. And then for some weird reason,
we thought... You mean inside the car as you're driving?
Inside the car. So as a passenger, I was sitting there with soaked feet permanently throughout the whole of my holiday.
Ever in a car.
It was ridiculous. But then for some reason we thought this is a great car, and then we went on Auto Trader and then found one and then went and bought that exact car.
With the water coming
Well,
in.
not that exact one, but the same one.
Okay.
And we bought it from a woman in Digbeth, which is a place in Birmingham.
Yes.
And anyway, it doesn't matter, but basically
But
I
did
didn't
Auto Trader tell you the price that you should buy that car for?
Well, it was the price on the website. I just pressed buy, basically. So I'm full of regret now.
Well, remind me never to let you buy a car, spend my money.
Well, I don't think that'll happen, but anyway.
Although
I'm quite happy to. Just throwing that out there. No, honestly, Dr. Paul, I don't even know what's happened here. It's been quite the education about so many things more than just, facial aesthetics. So it's really, truly been wonderful. Thank you so much.
Thank you for having me on the Joy of Shopping.
with your full range at QVC. Nassif MD, I'm going to be detox padding my way through life.
You do it.
Thank you, Dr. Paul.
Thank you. Bye, everyone.
Thank you so much for watching this episode of the Joy of Shopping podcast. You can catch up with all the other episodes in our YouTube playlist. Do not forget to subscribe if you love this sort of content. Thank you so much for watching.